This is the second part of the neuro assessment. For this one, I'm going to be assessing both the motor and sensory functions of the body. So to start, I'm just inspecting the body. I'll be inspecting movement as we move, just looking for any rigidity or excessive resistance during this exam. I'm looking at muscle tone, making sure there's no atrophy as well. Everything is symmetrical on both sides. Contour is within normal limits as well. So for this, I'm going to inspect the major body parts of the extremity, the shoulders, arms, hands, thighs, keeping adequate exposure the entire time, calves, and feet. Okay, tone is within normal limits, size is within normal limits, everything is symmetrical bilaterally, no atrophy noted as well. So next I will just do passive range of motion. So for this I'll just have you relax, and I'm going to passively move his arm. And flexion, extension, and circular movements, and his wrist and fingers as well. Both sides. And just relax your arm, let me move it. Okay, and I'm not noting any resistance. Movements are smooth, no rigidity. Tone in the muscle is good as well. And I will do the same passive motion with his legs. And passive range of motion with his other leg. Okay. And you just let me do all the work on that. And so, again, muscle tone is within normal limits. No rigidity noted or resistance to my passive range of motion. So next I will be grading his muscular strength. So for this one, it's graded on a scale of 0 to 5, 5 being normal resistance against my movement. Okay, so we will start first with the shoulder. So I want you to put your arm up like this. And so for each of these movements, you will resist my motion, okay? And then I grade it on a scale of 0 to 5. So resist my motion, good. Resist, good. That is a 5 on both. Next we will do the elbow. So I want you to turn. Don't resist right now. Turn, and then resist my pull, and resist my push. Okay, good. And these are testing for the shoulder. It was testing abduction and adduction, and then for the elbow, it's testing flexion and extension. Everything is a grade of 5. Next, I'm going to do the wrist. So put your, and then resist, and resist. Good. And then same with the fingers, resist. Okay, and resist. Okay, good. Then we'll do the same thing on the other side. So shoulder up and resist, and resist. Okay, both are 5. Now put your elbow up and resist, and resist. Okay, good. 5. And then for your wrist, put your fingers in a fist, and then resist, and resist. Good. Fingers out, resist, and resist. Okay. And all of that for the upper extremity is a 5. Resistance is within normal limits. Next we will do the lower extremities. So for this I'm going to have you lay back. And I'll have you push this knee up. There you go. And then resist me pushing your leg down. So try to push up against it. Good. And then push down with your hip. Okay, good. And then same for your knee here. I'm going to pull up, you push down. Okay? And then same, good. And then your ankle, resist, and resist. Okay. And that's testing the plantar flexion and dorsal flexion of the foot as well. Tested the knee and hip, and then I'll repeat it on the other side. Okay. Resist, good. Resist. Okay. And then with the knee, resist, okay, and pull it down. Okay, and then with the foot, push against and pull. And that's testing flexion and extension of the lower extremities. With the hips, we also test abduction and adduction. So put this knee up again for me, and resist my push, and then pull in. Good. And then same on the other side. Resist and resist. Okay, good. Okay, so that's testing flexion, extension, abduction, and adduction of the extremities, grading it on that 0 to 5 scale, 5 being within normal limits. So next we will move on to sensory tests. So for this, I am going to have you sit up. Okay. So for the sensory test, you will have your eyes closed the entire time for the remainder of these tests, and I will walk you through everything. But go ahead and open your eyes just so I can tell you. We're going to use half of a cotton swab, a sharp and dull test. So for this would be considered sharp, and this would be considered dull. Can you tell the difference? Okay. So now close your eyes, and I want you to tell me whether you're feeling sharp or dull.
Sharp.
Okay.
Sharp.
Put your arm out for me. Like that. Okay.
Dull.
Okay.
Sharp. Sharp. Dull.
Okay.
Sharp.
Okay. All right. So on the right side of his body, he sensed everything correctly. And testing the shoulder is testing the C-spine sensory. Testing the forearm medially and laterally is testing C-spine through T1 vertebrae. And then testing his thumb and fourth finger, which I didn't do, but I will do, would be testing his C-spine as well. So go ahead, close your eyes. Sharp or dull?
Sharp.
Okay, and I need to see your fourth finger here.
Dull.
Okay, and then testing the thigh is testing his lumbar vertebrae, testing the calves, lumbar vertebrae, and then testing the fourth toe is testing the sacral portion of the vertebrae. And so then I will repeat this on the other side. Okay, sharp or dull?
Sharp. Dull. 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 Sharp. 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 Dull. Dull.
Okay, and he had all of those right as well. So his sensory, as far as the sharp and dull test, is accurate. To go into more detailed tests or special tests, if any of these were cause for concern, I would do special tests. And for these, again, he's going to have his eyes closed. And first we will start with the stereogenesis test. So close your eyes, and I'm going to put an object in your palm and tell me what this object is.
Paperclip.
Okay. Keep your eyes closed. Next, we will do the graphesthesia test. Tell me what number I am writing in your palm.
3.
Okay. Next, we will do the 2-point sensory test. And so for this, I'm going to open up the paper clip using wide points and narrow points and tell me whether you feel 2 or 1 points of touch.
2. 1. 2. 2.
Okay. So next, we will test another special sensory test. So this is going to, I want you to keep your eyes closed, and this is going to, I will touch a spot on your body, and you just tell me where I am touching, okay?
Okay.
What body extremity I'm touching.
Elbow. Calf area.
Okay, and next I will check a distinction test. So I'll have you close your eyes, and there will be 2 points of touch, and I want you to tell me where both of those are at the same time, okay? Okay.
Both my arms. Both my knees, kind of. Shoulder and left knee.
Very good. Okay, so next, next we will move on to the reflexes. So for these, I'm going to start upper and work our way lower. So first we'll start with the brachial reflex, and I'll do this on both sides using my reflex hammer. And I'll just put your arm out, and I'm striking the hammer to my thumb, and I'm observing for the reflex of the bicep. Okay. Okay. Next, we will test the tricep reflex. So, again, striking my thumb. Okay, and noting that reflex. And just let your arm hang. Let it hang. Okay. Next, I will be checking the brachioradialis reflex. And for this, I'm using the blunt end of the hammer, striking it loosely. Okay. And striking it loosely. Okay. Next, we will do the lower extremity reflexes. I'm going to use the blunt end of the hammer to do the patellar reflex as he's dangling his legs, which it's not in great view of the camera, but positive reflex on the right, positive reflex on the left. Next, we will check the Achilles or ankle reflex, and for this, I'm using the blunt end of the hammer to the back of his Achilles and checking for that reflex. Okay, positive reflex on the right, positive reflex on the left. Okay. So next I will be checking those were all deep muscular reflex tests. Next I'm going to be checking surface level or cutaneous level reflexes. So I'll have you lay back. And for this I would keep appropriate draping of the patient, but I will be using the handle portion of the hammer to assess his reflex of the abdomen. So for this I'm going to have your shirt come up just slightly and then assess the abdominal reflex. Okay, and that is positive. Next, I will be assessing the Babinski reflex or plantar reflex using the pointed edge of my hammer on the bottom of his foot, starting at the bottom and working its way towards the toes. And for this, I observe the toes curving inwards, which is a positive reflex. He's also slightly ticklish, but that's okay. All right, and so there are those reflexes. Next, I will do, if any of those were abnormal, I would continue to test special reflexes. And for these, I would have him laying supine. In the first test, I'm going to flex his neck forward and observe if the knees also flex as well, which I do not observe. Okay. Next, we will be checking another special test where I flex the knees upwards and assess for any pain or excessive resistance of this test. Okay. No pain and no excessive resistance at all. That's very smooth. Okay, next we will do the straight leg test, and for this one, I'm going to have you keep your leg straight and we're going to lift it up, looking for any increased pain and keeping your foot flexed as well. Okay, and same on the other side. Okay. Okay, and that concludes. Actually, I just remembered a sensory test I had forgotten was the vibration test. So for this, I would use my tuning fork, and I'll have you sit up for this one. So this is just going back to those sensory tests again and having you keep your eyes closed. This would be another special test. If our sharp and dull test was abnormal, close your eyes, and I would have you tell me if you feel the vibrations of this and when they stop.
Okay.
Okay. And then same for in between his fingers.
Yep.
Okay. All right. And I did that in between the toes as well. That was not able to be seen in the video, but that's where that was done. And that concludes the rest of our neuro exam.